am Adesha Guntemitope. I'm happy to welcome you to another episode of Healthwise. Viewers at home, studio audience learning from our discussion today, I say thank you. The human body is diverse, with each part having its own peculiarity. In this regard, medical practice gives room for specialization in each aspect. In this series, we shall be looking at some of the various specialties that exist in medicine. You're on Healthwise, the Lagos State Health Advocacy Program. You all are welcome. I have Dr. Onoiga. She's the Director of Health Services and a Public Health Physician at the Lagos State Health Service Commission. A round of applause for Dr. Onoiga. Alongside Dr. Onoiga is Dr. Adedokun. He's a consultant family physician and also Chairman Medical Advisory Committee, LASOS. Please, a round of applause for Dr. Adedokun.
Thank you very much for having me.
You're welcome,
and
sir.
Thank Lagos State. Kudos to them for this stepwise program, very educative program.
Thank you so much. Thank you very much. Let's go on a commercial break and we'll stay here on Healthwise. Thank you. Medical specialties, what does that really mean?
I'll take it from history. When you were in the 1900s, if you wanted to see a doctor,
Okay.
you would, if your child had fever, you would see just one doctor. If your child broke his arm, you will see that same one doctor. If your wife needed to deliver a baby and she had gone into labor, it will still be that same doctor that they call. So those were the 1900s. If the child broke a bone, it's likely to be that same doctor that would fit it up. But if you wheel back and you fast track history and you come to what we have here now today, you'll find out that over the years, medical progress and a number of componential factors had led to people now finding doctors who would actually be very specialized in taking care of almost every part of the body. And what we now have is that the reasons for these are not far-fetched. One, there's been advancement in medical progress itself.
That's great.
You know, what we knew then is completely different from what people now know.
Sure.
And again, you found out that the advent of advancement in information and technology, urbanization, increase in the population, the demand of humankind itself as to the various areas had made even people carve out a niche of wanting to specialize in one area more than the other. And you find out that a country like America in the 1900s had just about 67 specializations registered. But today, America has 153.
That's great.
Subspecialties and specializations in every area that everybody... but I can tell you that Nigeria just has 15.
Wow. Wow.
Canada has 67 specializations. England has about 97. So every area, and you can imagine those areas, those countries also differ. You can see how high US has ranked in subspecialization. I would not say Nigeria has reached the brink of the race yet, but I mean, we're getting there.
We're getting there.
Yes.
Thank you very much. So, Dr. Adedokun, can you give us examples of some of these specialties that exist and briefly explain exactly what they do?
Thank you very much. Every organ system in the body has a specialist to look after it.
Wow.
Oh yes. The eye has the ophthalmologist to look after it. The brain and the nerves have the neurologist to look after them. But broadly, especially in Nigeria, we have surgeons, those who solve medical problems with their knife. It take people to theater,
Yeah.
okay? And amongst them, you have general surgeons who operate almost anything. Then you have orthopedic surgeons who operate bones. You have neurosurgeons who operate the brain. Then, of course, you have the internists, those who solve people's problems with drugs, drug prescription. And those are internists, okay? And they're also general. You also have various subspecialties there. You have hematologists that deal with the blood, okay? You have dermatologists that deal with the skin. You have nephrologists that deal with the kidneys. You have hepatologists that deal with liver. You have gastroenterologists that deal with the gastrointestinal tract, etc., etc. You also have gynecologists and obstetricians. These are people who deal with women and reproduction, okay? Obstetricians are those that deal with women who come into labor or who deals with problems of conception, how to get pregnant and how to take care of the pregnancy.
Sorry to cut you short, sir. So as a medical doctor now, in Lagos State, how many of these specialties do we have?
Well, I can tell you, frankly, Dr. Noiga said we have 15.
15, okay.
Specialties across board. But I can tell you that mostly all over, generally we have surgeons,
okay.
We have internists, we have gynecologists, obstetricians,
Yes.
and we have pediatricians. Those are basic 4 clinical areas.
Okay.
And those areas are available in Nigeria. The pediatricians are those who take care of the children. But then we have subspecialties under them.
Thank you very much. A round of applause for our guests. When a patient comes into a hospital, how does she or he know the appropriate specialist to see?
Well, if a patient comes into the hospital, they probably won't know the specialist that they are going in to see.
Okay.
And that is the crux of the problem for the society, and they need to know. One, this is mainly because of our literacy rate. Nigeria has a literacy rate of 6.1. And you can compare it to a country like Egypt that has a literacy head rate of 7.2. It's also an African country. But an average boy in the street in Egypt will tell you, I'm going to see the ENT to solve my nose problem or my cold right from the street level. That may not be the case in Nigeria. But nevertheless, when you do get into a hospital, there are different types of doctors that you see. You see the generalists, who are the frontline doctors at every level, both the primary care level and the secondary care level. And what they do is basically to listen to your complaints, and they will be able to identify that, oh, you will not need a specialist care, they can handle this. Or you would need a specialist care and you need to go to a specialist who are within the confines of the walls of the hospital as well. So they normally will refer you to the gynae, refer to the ENT, or ask for a consult of those who would appropriately deal with that area. So that's basically the only way that most people in Nigeria will be able to know which specialists they need to
To
go to or to see. It is mainly by them being sifted out by a group of doctors. But even more so these days, we are having specialists in family medicine who really are a specialist on their own, but they are the kind of way they're specializing is that they're being able to sort out who needs who and what level of they could deal with it. There are things that they themselves could deal with. They would deal with it on the family level.
Yeah.
And if it now needs an intensive intervention by a specialist, they go in. And they're being brought into the scheme of things is a welcome idea, because that will help us not to waste times thinking everybody would need a specialist care.
Sure.
So,
So, Dr. Adedokun, how affordable is it to see a specialist?
It's quite affordable to see the specialist.
Okay.
First of all, in the public sector,
Okay.
it costs you next to nothing. Oh, yes.
Okay.
Like Dr. Noiga have said, you go in and most of the issues are sorted out on the generalist front, particularly now that we have the family physicians known as the specialist generalists. Okay? That's their specialty. They see much more than everyday doctor will see.
Okay.
Will solve problems much higher than everyday doctor will see. So that's their specialty. But if it comes to an area where they cannot handle, perhaps because of intensive care or they require high dependency to manage, then of course goes to the appropriate specialist. However, people have the idea that, you know, seeing a specialist is expensive.
Expensive, yes.
Both in the public sector and even in the private sector. They are not expensive.
Okay.
It is our mentality. And that precludes people from actually accessing health, which brings about a lot of complications.
Thank you very much. Thank you so much. A round of applause for our guest. Now let's talk about the implication of not seeing a specialist, Dr. Noiga.
I think that when you don't see a specialist and you were meant to have seen a specialist, the individual, the nation, or the community, they are deprived of the specialized care that they would ordinarily have needed to be able to get to the root of the problem, of their health problems. And of course, that will lead to a poorer health outcome.
True.
And also eventually a poorer health status for the individual and for the community and the nation. And inadvertently, it's going to affect our health indices and indicators. And as a nation, the indices of Nigeria will get poorer and poorer rather than we improve upon it. And the earlier we could get people to understand that there are specialists in the hospitals that will take care of them and that they need to engage these specialists so that they can get better outcomes. They should not shy away from actually seeking their. Many a times you see people, they would rather even go to a chemist and ask for Panadol to treat themselves. The other day, this is a joke, but it's true. I was at a party, I was seated, and you know the way they distribute gifts all over? They were distributing Panadol as a gift on the table. And I smiled because I thought, interesting. People are going to take this home, and at every beck of headache, they're going to get it drunk. And that necessarily may not be the answer to the root cause of their particular headache. And of course, what do we have? Abuse.
Yes.
And of course, we get this current increase in kidney failure and things like that. And so really people need to be educated that there are specialists available in the hospitals and they can access them. They would be referred at every level of care. At the primary level, if they know that you do need specialist intervention, they'll refer you to the secondary health facility.
Okay.
And at the secondary health facility, within its walls, has specialists in it as well. They would refer you appropriately to the specialist that needs to give you the comprehensive care that you need.
Thank you
And
so
people
much.
should
A
be
round of applause for our guests. Let's go on a commercial break when we're still here on Elsewise. Thank you.
Welcome to the precaution segment of HealthWise. Your visit to the doctor is your time to talk and learn about your health. For first visits, take any previous test results. Be prepared with a list of questions. Because you may be overwhelmed with the information thrown at you, take notes or go with someone you trust. Know your family's medical history. Be honest with your specialist and don't leave out details. Thanks for watching. Join us next week for the concluding part of this episode. Bye for now.
There could be flooding, ocean surge, collapsed buildings. The Dana air crash is very recent in memory. And we all know that possibly a lot more people could have survived if there had been some element of immediate response to their needs.
If there was a patient with burns, what people will do is to add something like pepper, onion, or oil, or raw pap to the situation, and that is absolutely wrong.
Wow.
What they are doing in essence is that they are asking for the tissues under that thing they've spread to continue cooking. What will be reasonable and scientific, for instance, is to pour cold water.
A city such as this, with the amount of people that we have, it falls on us the enormous responsibility to be able to build enough capacity to respond to emergency care. And that is what has brought about all these intensive interventions that we have.
Thank you so much.